Good morning.
How are you? I just love that little new opening. I see all the little pictures. I'm tickled.
Uh,
Be like, I remember what we did, what we was talking about on that day. It just tickles me. How are you?
I'm good, thanks. How are you?
Oh Lord, I'm here.
All right.
It's been a week. It's been a week. It's been a week. But it's been good. It's been good. Let
Good.
me get rid of this banner here. Uh-oh, not that banner. This banner. Okay. All right, I think I did. I think I did. Oh, I didn't welcome the people. What happened to the little? Okay, it was showing a little um see, I don't lost my train of thought. Captions. There were some live captions showing right there, but then they went away. I don't know what happened. All right, sorry, y'all. I don't know if I did. If I made the live captions go away. Okay, but anyway, you had a good week.
Yes.
DC was fun. DC was fun. We'll talk a little bit about DC
You
and the
didn't even tell
advocacy.
us you were going. I
I
don't rem-
didn't.
I don't remember you mentioning it now.
Oh, well, I went to
I
the
was like,
the
oh,
AHIMA Advocacy Summit. Yeah, March is normally crazy because sometimes our annual meeting and the summit collide, which happened last year, which is why I wasn't able to go. But this year, the Advocacy Summit was last week, and our annual meeting is this week. So I'll be in Columbus. I drive up tomorrow, so I'll be in Columbus until Wednesday night. I come back Wednesday night. So yeah, it's busy in these
uh,
health information streets, but
but
very,
that's
very,
good.
very interesting. Very okay. The captions didn't come back, so I don't know. I don't know what's going on. Good morning, Tanika. Welcome, welcome. Oh, they pop in and off when I do something, they go away, but then they'll come back. I don't know, but welcome everybody to the Saturday morning tea, um, where we discuss, as you can see, all kinds of things, including tech. But we primarily discuss health information, news, education, certification tips, and entrepreneurship. And basically the healthcare revenue cycle at large. And so as you come in, don't forget to hit the thumbs up or like button. I'm Clarice Warner. I'm the girl with the pearls, the founder and senior education director of the Professional Reimbursement Network, LLC, where coding education is key. And PRN is a healthcare compliance consultancy located in Cincinnati, Ohio, that specializes in revenue cycle and regulatory compliance and education. So let me ask, do you know what it takes to be a certified marketable medical coder? There are several hundred folks who do, but there may be millions that don't. So if you don't, um, let me provide you with some information on a free email course on the 5 steps to become a certified marketable medical coder. And then I'll introduce you to my co host. You see how I flipped that
Yeah.
up? Are you interested in medical coding, but not sure where to start and scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. All right. Yeah, I'm on the flip up today, I guess. So, if you are interested in getting more information about the 5 steps to become a certified marketable medical coder, again, it's a free email course. Check out the video, and there are no exams on that course. Check that out. Check out the
Uh,
video description for the link. So, joining me today is my co host, Mr. Jesse, the registered trademark. Put some respect on his name, the coding nurse. Sir, introduce yourself and tell the folks all about you.
Good morning, everybody. My name is Jesse. I live in Philadelphia. I have been in healthcare for a very long time. I transitioned into HIM in 2014. During the pandemic in 2020, I created a company, the Coding Nurse LLC, where I help nurses and other clinicians and with a clinical background transition into the wonderful world of HIM.
Mm-hmm. And how's that going, sir?
It's going great. I finished my PCS class last month. Was it? I think this week, this past week. So
Okay.
I am really glad because I was tired.
And how are those students? I'm sure better for the information and knowledge that they received on
Well,
PCS.
I would like to think so.
I believe that, sir. Do you give them an evaluation?
Yes,
Okay, okay. So I'm sure that evaluation will give you all the information that you need to know that they walked away a little better than they came in. How about that?
absolutely.
All right, all right. So, um, before we jump in, let me remind everybody that this is a conversation. We bring the topics, we add our own little spin to it. Y'all know how we do. But this is actually a conversation, and we want you to join in on the conversation. So feel free to share your opinions with us, and you can do so by using the chat because your opinions matter and they are definitely welcomed here. So, using the chat, um, you can stop by, say hi, tell us where you're checking in from. And if you ask a question, all I ask is that you put a Q first so that we know it's a question for us and we don't miss it. We wouldn't want to miss any questions that we receive. Okay. So, uh, for those who are just joining us or watching the replay, today we are discovering CDI survey secrets. And I'll talk a little bit about um, the AHIMA Advocacy Summit that went down in DC last week. But first, we have our church announcements. Yes, yes, yes. I wish I knew how to play the organ.
I know.
Because don't let me chat GPT how to play the organ. How to hit the keys on my computer to make it look like an organ, and it'll be all over. I'll be over here composing.
But I'm sure you might be able to do that because
No, now that I'm thinking about it.
you can learn the piano with your iPad.
Now that I'm thinking about it, it's gonna go down. I'm feeling it in my spirit already. Okay, so real brief. So for my Patreon folks, I don't know what happened to my announcement that I sent yesterday, but it just popped up this morning. So you would have received this information first, and if you've been out on Patreon, you got it. But we talked about a while back the Corporate Transparency Act and how folks were putting the fear in small businesses to make sure that they comply with all of the things related to that, all of the reporting that was necessary. But the CTA or Corporate Transparency Act has now been found unconstitutional by the court. The United States District Court for the Northern District of Alabama, in a case, National Small Business United versus Yellen, declared that the Corporate Transparency Act, or CTA, is unconstitutional. Although FinCEN, who is the entity that was part of the regulation in putting together the requirements that folks must submit documentation and register their business, announced that they will comply with the court's order for as long as it remains in effect, and that the government is not currently enforcing the CTA against the plaintiffs in the case, which would also include members of the National Small Business Association. it is likely that that either the decision will be appealed by the government, which they probably think is going to happen, and that pending the appeal, the decision will be stayed, or FinCEN will propose amendments to the CTA, which, if adopted, will address and seek to cure the constitutional issues. So, question comes up: well, what do we do now? We kind of in a lurch. How do we move? So, this legal update from Stanley Block, who is a partner at somebody's law firm, Safeforth. Anyway, he recommends. There are three things that he recommends. The first one is, if you were in existence on January 1st, 2024, so if your business was already in existence, then you technically didn't have to do anything until the end of the year anyway. But he says, just continue to gather your information required to be disclosed, but delay the filing of the report until later this year, when hopefully more information will be available on the effect of the decision. He also says it should be noted that we have generally advised entities falling in this category to, in any event, similarly delay filing their reports, with the hope that as the year progresses, FinCEN issues further clarifications of the CTA. So if your business has already been in effect prior to January 21 or January 1st, 2024, he says hold off, just wait, put the brakes on it, just chill out, keep getting the necessary information, but don't file, just hold it. Second, with respect to entity formed this year, in which case they have 90 days from the date of formation to file their beneficial ownership report, he also suggests to continue gather information required to be disclosed, but delay the filing of the report until the end of the applicable 90-day, or if earlier, until further clarifying information is available. So wait until the last day if possible. Third, with respect to entities that are members of the National Small Business Association, regardless of when formed, FinCEN's initial response, like many aspects of the CTA, is less than entirely clear and does not offer specific guidance as to whether or when in the future it will seek to enforce the CTA. So, despite FinCEN's announcement that is not currently enforcing the CTA, the best practice for those in the National Small Business Association would be to follow either recommendation 1, if their business was formed before January 1, 2024, or number 2, if their business was formed after that. So that was my church announcement. Mr. Jesse, did you have anything you wanted to?
It's really interesting because I didn't even know that there. Did you know that there was pending litigation?
No,
I
did not.
Exactly.
I know folks was up in arms, though. People were upset about it. And there had been several, I saw several posts, like, what, because the thought was, and I guess it's true, that it's really impacting small businesses the most. And supposedly the reason for this, or the overarching reason, was to stop the smuggling of money or terrorism or something to that effect. This is the way they were smuggling funds through financial institutions, and so it was all willy-nilly, and they wanted to kind of rein that in to find out who's owning what and who's responsible for this account and the money and da-da-da-da-da. And so small businesses were all out there protesting, if you will, via the internet with their posts, saying that this was unfair to small businesses to put this additional burden on them to have to file these reports, da-da-da-da-da. So I guess the National Small Business United agreed, and thus the lawsuit became official. So yeah, it's very interesting. I chuckle all the time because I'm like, you would think federal entities, and this is not the first time that this has happened. It happens frankly quite a lot. Y'all don't get enough information to make sure everything is tight before y'all go out here and enforce this stuff. So that's interesting to me.
Yeah.
Like, get your stuff together. take all of that. Okay, okay. So that was my church announcement for the day. Hopefully, that was some news you can use, something that can assist and help. So,
Absolutely.
yeah, I thought, hey, that's one less paper, one less thing I got to do on my to do list. All right, so let's get into this. So, Mr. Justice, did you want to take this? How are we doing this? And it was all
Well,
about you because CDI is where you land and you live. So we want to look at the um, CDI survey secrets. Let me just say this: I
mm,
love the fact that they are doing comparisons from the previous year to this year and a lot of stuff. I thought that was quite interesting. And I can bring it up if you want me to bring it up to go through and
you
show.
you can, yeah.
Okay.
But I made some notes,
Nope.
and I don't really. So,
Let me get my tea ready, Lord.
no, no, no. But it was really interesting because what fascinated me the most is they only had 145 respondents, but they got a lot of information. I'm
A
like,
lot
well,
of information out of them 145, didn't
they
they?
sure did. So, and I had always heard. So because I had to go to Wikipedia and do some research because
Okay.
I wanted to get some more information on this ICD-10 AM, which is the Australian
Australia.
modification.
Hmm.
So um, I found out that um, Australia had adopted ICD-9 in 1994.
Hmm.
Then in 1998, they developed their own modifications for ICD-10. So in 1998, the ICD-10 AM was formed.
Hmm.
And they said that, because I was trying to find, well, what countries use it. So because it just says like the main ones are Australia, Ireland, New Zealand, and Saudi Arabia, and several other countries. So I'm like, well,
Hmm.
what are the several other countries? So I found out that it's Bahrain, Qatar, Solomon Islands, Samoa, Fiji, Romania, Slovenia, and Germany. Now, and I'm like, but how come they're not reflected in this survey? Because in the survey results, it's only Australia, New Zealand, Saudi Arabia, and Bahrain and Qatar.
Mm.
Which, when you look at their results, so let me see because I have it on my other screen, the page.
So if you are joining, the actual link to the survey is also in the description as well. If you want to do a
And
deep dive.
they make some money, but I'm trying to because it's on page 5.
Okay.
They really only focus on, and the other in the location it says the other in other countries including Qatar and Bahrain. But I'm like, if especially Germany and Romania, I would think that they would have. I don't know, but I thought then I thought, well, maybe you know there might have was it translated because there might not have been, so anyway, so I thought that was interesting that they have all these countries but they only got 145 respondents, and their graph only included certain countries
Hmm.
because I've seen advertised CDI positions in Saudi Arabia, and I was like, and then when I saw that they used the ICD-10 AM, I'm like, oh. And I actually follow someone on Instagram who has a coding company in Australia,
Hmm.
and their codes are slightly different, but they kind of, you could probably figure it out. It's all just looking it up. But
Hmm.
if you know how to, it's just interesting how they do it, and they also have a procedure code set called ACHI. And what also I noticed in the result is they said the average salary. So basically, starting salary they focus this mainly on Australia, but they have other salaries by regions in the report too. So the average starting salary of 6 months or less in CDI in Australia is $90,000. The average Australian salary is 68,900. So that's a pretty, significant number.
Mm-hmm.
That's a good chunk of change.
Mm-hmm.
So then it went on to say, of course, the majority of people in CDI are registered nurses
Of
in their
course.
area. But what was interesting is the gap between registered nurses and HIM and coding was not as significant as it is here in the United States. So
Hmm.
I found that to be interesting, and it's a lot more fair to be, in my opinion.
Hmm. I agree.
And they started it in 2022 was the first year, and this year is the 2023 was the second year.
Okay, so this is relatively new.
Yes.
But again, I like that they're keeping a trend, or they're keeping a
Yes.
comparison going as they, hopefully, as they get more people. Because I didn't know anything about this. I just happened to
Mm.
see it. I stumbled upon.
Yeah.
I was like, well, wait a minute. Does anybody else know about this? And so maybe as more people who become aware, then maybe they will also become engaged enough to be part of the survey.
And what I also found interesting is they have a CCDS credential, and at first I thought they were part of Actis. So it's on page 8.
Okay.
It says CDS certification. So it says Clinical Documentation Improvement Australia, an organization delivering CDI services in ICD-10 AM countries, offers CDI professionals the chance to attain an industry qualification in CDI. And they have levels, and it's based on years of experience.
Mm.
And what I found interesting is like there is no mention of CDIP in this article, and I thought that the AHIMA credentials were supposed to be. I see you sipping. Uh, and I thought the AHIMA credentials now were supposed to be international because they did away with the different versions. So I was
Yeah,
like,
that's
that's
interesting.
interesting. Yeah,
Yes, yes, because we're global,
supposedly.
global.
Yeah. And what was interesting is only 43% of the people who responded work remotely.
Really?
Mm-hmm.
Mm.
Because to me, like, because then it gets into like queries and all that. Like that's I just think like for this, I just kind of like focused on like the highlights because I wanted to know where the ICD-10 AM countries were, how much were they making, what's the credential, and of course the money. So,
Of course. Where to follow the
but
money? Where the money reside? Where the money reside?
but like you said, I do like because they were saying that one of the takeaways that they realized from this report was that a lot of uh, basically there was not enough like professional development
Mm.
amongst the respondents. So they said that they wouldn't have known that if they weren't doing these surveys. So they're going to work on more professional development for I guess once you get into CDI, which I thought was kind of interesting. Go ahead.
I like that. And I appreciate that they are actually taking the time to kind of go through and find um, the pain points and then creating solutions for them. Because oftentimes, you see these surveys, you enter the surveys, and really it's just, I mean, they're collecting the data, but then all they're doing is spitting the data back at you. There's nothing to, say, well, in some of them they do, but in a lot of them it's just, okay, well, we're just telling you what the range of the um, salary ranges, or we're just telling you what the jobs are or the titles are or that type of thing. But then, okay, now that we have this information, now what? Are we going to try to standardize these things? Are we going to, take some action to make sure that folks are being compensated appropriately? I mean, what's the end game? But I
Exactly.
like that. I feel like that they, were really, really interested in the information that they receive, so much so that they are um, at least trying to put together some solutions. So they're more solution oriented as it relates to gathering this data versus just gathering the data for data's sake.
Because I don't really follow actors like that because I don't have any actors credentials. But even AHIMA, like I have never seen, the only report that I've seen that comes close is AAPC. Like AHIMA doesn't put out this kind of reporting. Like not this level of, like these people drill down.
They did. They did.
And I'm like, see, this is something that you, anybody who would even be remotely interested, if you read this report, you would really be able to know exactly what you're getting into, what it looks like, where you could work, everything. And I just don't, I'm not really seeing anything like that in CDI, domestically.
Interesting. Oh, but let me put you up on game. So, um, you know, if you attend AHIMA events, oftentimes, they have like announcement slides kind of running in between sessions or at breaks or whatever. And um, they're going to, on a couple of the slides, they mentioned that they will be offering, I guess, CEUs, nursing CEUs at some of these AHIMA events. I had never seen anything that display. I don't know if they have offered them previously, but they were making the announcements about
Mm.
offering these nursing CEUs for a lot of the upcoming AHIMA events. I thought, because I asked somebody like, "Whoa, whoa, 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 what was that? Did y'all just see that?" Because I had never seen that before.
Now, the only thing that I knew about that was, now their training, you can get nursing CEUs, but
Well,
I
no, these
don't
are events at
see.
events.
That's what I'm saying. Like that's the first I've heard.
Hmm.
I
Yeah.
wonder
So,
what now. I
well,
really
I think
wonder what
that's that Actus integration. I think, I
there
don't
you
know.
go. I definitely think that's what it
I think
is.
it's part of that integration
So
there.
step one, but there
Buckle up.
exactly. And there's another on page 9. It was saying that
Oh
um
yeah.
yeah, for right above motivation, that chart right there,
Okay.
and it says that 66% had a clinical background and 19% had a health information or coding background, and 10% had both, which I thought was, you don't, once again, you don't get this kind of detail
Mm-mm.
from CDI here, or even coding.
True.
So I was like, I mean, whoever did this, they know that they own that stuff.
And hopefully, and maybe again, as information about the survey comes out, somebody can get some pointers. Maybe here's a template right here to some of the
Exactly.
things that you can ask or inquire about, or collect the data on. I thought this motivation thing was interesting as it relates to why people are coming into the field
Hmm.
of CDI. Some of them stated it was for professional growth. Um, uh, some of them, it said this was most of it. Well, the majority, I guess, was for professional growth. Some was to transition from direct patient care. Of course, those who are clinicians said that more frequently than the rest.
Right.
Stability of regular hours. Like, you never, because of course, clinicians, them hours can be rough, but that was interesting as well. I guess here's the chart as well. Some people were actually asked or directly recruited into CDI roles. Um, I kind of chuckled at that. Like, is it because they saw that they were better suited over here versus direct patient care, or
Yeah.
or not?
See, I interpret directly recruited as gatekeeping. It's the,
Well,
listen.
that part too. Look, I knew somebody else would have a different perspective, and I knew that would be you. So we gonna stack the deck on who we have in these particular roles.
Uh,
i.e., gatekeeping, and then some other which were a lot. I mean, comparatively, there was a lot of other diverse motivations. Um, Somebody said, I have done the role previously, enjoyed it, and want to further pursue it. Moved to a regional area, and this new role was available. As a senior state clinical coder auditor with a medical background, I always believed in the need for the CDI role, and it is my passion to contribute my knowledge in both coding and medicine. Both wanted a change to grow professionally, make a change, and also the predictable hours of family slash work balance was appealing. It was added to my portfolio. First job offered after relocating to improve the accuracy of documentation or DRG assignment in real time and to improve documentation standards. Educate revenue teams about the importance of accurate terminology relating to patient care. So I thought that was interesting
now
on.
this section, oh, it is this section, education and training. I found interesting too. Like 15% were self-taught. I would love to know what, like,
They took the initiative to acquire the essential CDI expertise independently. This reflects a self driven approach to professional development within this field. However, this puts a high degree of responsibility on the individual and likely means that CDI programs take more time to establish, as CDS must first take time to educate themselves. Hmm.
I want to know where and how.
Mm.
See that.
Mm. Mm. Where's my tea? I need to bring it closer.
Because that's not well. I mean, it's only 145 respondents again, but I just think 15%. That's a large. I mean, how did you do it? Like that? I'm because everything else makes sense. Like the external CDI provided training, and even on the job training. But because that was the bulk of them. But those outliers will get you. Because I would expect other to the self taught to be like 8%.
Yeah, the other. So where are
Right.
these other folks coming from?
Exactly.
And how are they getting through? Like into the role? You know what I'm saying? Is this, or do they have a direct
Uh, uh,
direct gatekeeper line? I don't. Girl, learn all you can about so and so and so, and we got you. Come on through.
hmm
I don't know. Wow. Um, this was interesting too. Um, about how long they were in their roles at the time of the survey.
Yeah.
Like, at least it's growing. Um, oh no, it's shrinking. Well, from 1 to 2 years, it's shrinking, but this makes sense for it to increase year by year.
Right. And it seems like there's a lot more. Well, there's newer people in,
Coming in.
yeah, in 2023 versus 2022. So they'll eventually fill out those other
Yeah.
areas.
So I mean, that's promising. I mean, it's
Mm,
relatively low, but it's growing. Folks are dedicated in their role. This hopefully indicates a high retention rate and a commitment to the positions, hopefully. Then it talks about the different organizations. I'm like you, the number of staff that folks had. It's interesting, 1 to 3 um, in their organizations. How many CDIs y'all got over there?
oh, we got like 100 and something.
Yeah. Well, you guys are a larger
Right.
um, revenue cycle
Right. But
organization.
at my particular hospital, it's like 8 of us. And
That's
it's
still a
not even a
lot.
big hospital.
That's
But
still
it's
a lot
but
comparatively.
they have it's the same people over and over and over. I mean over and over and
Somebody making some good money over here. They had six figures.
over.
All right, all right.
Well, I
And
mean,
increasing.
yeah, well, entry is 90K, so yeah, that's a hop, skip, and a jump.
That's right. That's right. Just stick to it for a little bit.
Mm-hmm.
Okay, and then this was a comparison to the time you were in the role and your salary. Okay. Middle East need to come on up. What's happening here?
Exactly.
uh, certain qualifications. Oh, and then I saw that. Did they require? Yeah, those requiring a CDI certification increased. The requirement for a health information or clinical coding qualification reduced. Uh, however, organizations require either a health information or clinical coding background or a clinical background also a lot, 13 to 28%. They feel like this was a pleasing development as it could show that organizations are recognizing that both groups have important knowledge and skills to bring to the CDS role. And also, it allows for multidisciplinary teams with some clinical and some health information staff being recruited to the CDS role. Interesting. Most of them report to health information services. Do y'all report up through health information or
No, we go from revenue cycle to the CFO.
okay, cool. That was a I'm thirsty tea. That wasn't a All right. So this was I think a great survey. I thought it was good information here. Um
It was.
I'm glad I saw it, and hopefully, as you all take the time to kind of look through it and review, um, especially if you are in the CDI or you work within the CDI realm of things, that it will be helpful for you.
And this caused me to do another little deeper dive, and I came across the Pan American Health Organization.
Mm-hmm.
They teach ICD-10 in Central and South America. They do uh, they break down their curriculum into 5 months.
Mm-hmm.
No, 5 courses in 3 months. And I'm like, wow. And they do it remotely. So
Okay.
I'm like, shoot, I need to be learning me some Spanish. And I'll teach. No, why not?
See.
Exactamente.
Babbel was having look this podcast is not sponsored by anybody, but Babbel was having some sales. They were having some sales. Okay. Oh, that's crazy. That's crazy. All right, so let me give you a little tea on the advocacy summit. So again, this is the time that all of your component association advocates actually is open to anybody, any members of AHIMA, but you are allowed to come. And their first day is a policy kind of session where um, they talk through some. It's a lot. We talked about ICD 11, which I'll briefly touch on, and then my favorite topic was meeting the our sisters up north. The Canadian Health Information Management Association was there.
Okay.
And so that was very, 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 very interesting to say the least. We also oh, and I'm gonna need y'all, our fellow. She said Rosetta Stone. I cannot.
Wow. Right. That's right,
Look, I
Tanika.
knew y'all was out here in these streets. um, um, as I've met our new AHIMA's new CEO, and I think he's been here for like they say 6 months, 9 months, something. He's been here for a minute now. So weighing whether or not everybody needs to keep calling him the new CEO. Anyway, he is off the chain. Let me just say that. He is. I don't know if it's a. I think it's just his personality. He's in Florida. He actually has roots in Ohio. We got to talk. Y'all know if you've been in any AHIMA meetings where he's been introduced, you know he gives out this phone number and his email address, and he wants you to contact him if you have questions or concerns. And he really seems interested in understanding members' pain points, um, and hopefully working together with the leadership and the board to address them, etc. I wish he had been around when all of this stuff about this 40%, but he's it, he's adopted that into his role now, but he wasn't, part of the decision making piece. It would have been interesting to see the outcome of that. I feel just in hearing some of the things that he says and the approach that he makes and his perspective. Because there was a lot of concern, or a lot of people were kind of like, he's a doctor. What is he doing over here in our role? And we get that because I think we had some of that with Wylesia when she came from a nursing organization. Like, because I don't think she's a nurse, but I don't think she's a nurse, but
I don't think so
she
either.
was part of or CEO of a nursing association. So it was like, what they doing over here? You know how territorial we can be. Um, and he recognizes that, and he says, "But I understand your worth. If you don't, I understand your worth just from coming from as a physician. I understand the importance of the work that you do, and so that's why I am truly an advocate of the health information professional." So I appreciated that, but I also asked him because he did a podcast in another state, and I was like, "You gonna do one for me?" So if y'all have questions for him, send them to me. You can email me any questions that you may have. I will definitely wait. Let me put this up here. You can email me any questions you will have because I want to send him questions beforehand because he did. That was the request that we send the questions prior to, and we'll see if we can get him on to be his wonderful self and talk to the members because again, every member doesn't come to all of the AHIMA functions. Every member may not even be able to come to their component association stuff, especially if they have transitioned back to in person, and if they are in rural areas or live far away, um, or don't have even their regional stuff could potentially be far away from them, and they can't get there. So, if you got questions that you think I should ask, or you want uh, him to respond to, send them to me at cwarner@ohioprn.com. So, um, let's talk a little bit about the uh, ICD 11 adoption. And this was a very spirited conversation. As you all know, ICD 10 or ICD 11 is out. Several countries have already adopted it. Some of the larger countries are still kind of on the fence. You all know we are still currently in debate on whether or not a clinical modification uh, should happen. Most folks are advocating against it um, because that is one of the things that one takes up a lot of time and holds us out from adopting the ICD 11. The concept of pre-coordination versus post-coordination is really really crucial to this adoption, and it's based on their architectural foundation of clinical concepts. So they're putting everything together that way. So even though ICD-9 was its own animal, ICD-10 is a little different. ICD-11 is the focus is totally different. And ultimately, the goal, as it was explained to us at this summit, is that they don't want to have ICD 12. They want to stop it. They want to have it where you now just have the revisions to um, the ICD 11. So you don't have to do a complete overhaul like they're doing again. And unfortunately, for whatever reason, there wasn't the foresight when they created ICD 10 to have this at that time. Um, they are gearing up because it took a long 25 years to adopt ICD 10. Um, and a part of the reason, and so somebody asked about the benefits. Do they feel it was a benefit to go from 9 to 10? And there are a lot of people who are still not in agreement with the adoption of ICD-10. They don't feel that there was necessarily a benefit. It made things more, and I think this is more on the practitioner side, it made things more confusing, um, and all of those things. So they have a lot of stakeholder engagement and involvement that they need to do. One of the suggestions was particularly with the provider community, because that was one of the reasons why we had that pause, because they were like, absolutely not, we're not doing this right now, no. And so they fought it. So it's really important that they get ahead of that curve and involve and engage those particular stakeholders now, while they're contemplating um, the adoption of ICD 11. Um, Again, you can go out. They're anticipating a transition of a couple of years. So all the painful transition that we went through from 9 to 10, um, unfortunately, it looks like that same stuff is going to happen here from 10 to 11. And again, folks are wondering, like, will we survive this? Can we survive this? I remember there was a huge uh, uh, position that folks were like, you know what? I'm at retirement stage. I'm out. I'm not doing this. I'm not doing this at all. And we may also find some of that again here with this transition of ICD 11. The other part was that they are not. Um, so PCS is its own animal, and it would stand alone. There will be no like ICD 11 PCS. PCS is not part of this mix. It's only um, the diagnosis uh, coding. So again, some of the thing or barriers to the United States adopting ICD 11 as it stands today. Well, there was also talking about um, present on admission coding. So we have some specific rules related to that. They don't necessarily have those there. And so um, it offers the opportunity to have some what they call extension coding. Um, and that can kind of take the place of what the CM would do. In some cases, um, they feel like some other things that ICD 11 would do is ramp up the health informatics workforce, because they would need to have more people help build the system to connect all of these code clusters with clinical documentation. Um, uh, there was talk about the whole SNOMED CT, and how it's an issue or a challenge because it's a proprietary system. But the thing about it is, for those of us in the United States, we all have access to it. Other countries outside of it does not. I believe it's our proprietary of system. And then, like I was mentioning, the barriers to adoption include return on investment, whether or not the clinical modification piece will be created or should be created, and then the documentation and coder workforce burden. So those are the top things that folks were mentioning as it relates to that. Mr. Jesse, did you want to?
Well, yeah, because I mean, I got in 2014, so I learned ICD 9,
Hmm.
and truth be told, I like ICD 10 much better than ICD 9 because it's a lot more detailed.
Hmm.
And there was a lot of gray area with ICD 9.
Hmm.
And I definitely see, how it closed the gap. And when you look at, when I looked at a couple years ago, when I looked at the ICD 11, it's even more detailed
Hmm.
and it's in a different format. So what my main takeaway is anybody who is interested in education, now would be the time because when they do implement ICD 11, Clarice and I are going to be busy training folks
Every day.
because
Every
all
day.
because all these organizations are going to be they're going to be cramming for people to come in and teach their staff.
That's right.
So anybody, look, once again, like we always talk about entrepreneurship, you got to see it, you got to see it coming and get prepared.
Be prepared. And already you can go out to I think it's the World Health
Yeah, it
Organization's
is.
website
Mhm.
to kind of play around in there and get ready. Get ready.
Because my only thing is, excuse me, I just hope because there's going to be even more codes in ICD 11 than in ICD 10. But I still hope that there is a book. This whole concept of this,
The
these
electronic.
encoders, I just can't.
I
I
agree.
really can't.
I agree. I agree. So then last thing I want to bring to you all's attention is again, we had the Canadian uh Health Information Management Association. Um Folks there, I think we had their wait a minute, let me tell you specifically who we had there. There were three folks on the panel um providing us with all of the information. We had their the CEO of the Canadian Health Information Management Association. We had the Senior Director of Partnerships and External Relations, and the Vice Chair of their Board of Directors, who were present. And they were cool. They were cool. I didn't realize that there's a lot of rural areas in Canada.
Oh
I guess
yeah.
I don't know enough about. Well, I guess we got a lot of rural areas here, but there's a lot of rural areas in Canada. So that's a huge challenge for them and getting information out. Oh, you said including me, including
That's
Tasha. Yes, ma'am.
that's right.
For getting information out, and so one of the things that I loved about them is that they believe in certification so much so that um, their workers, in order to be part of the health information profession, they have to be certified. It's a requirement. So I was like, well, look over here. I mean, I think we tried to go down that route before, but then I think for some reason, I don't know if it got caught up. Well, it's now it's state specific. So certain states require, and I don't even know if those laws or whatever are still on the books, but it fizzled at a national level, which I feel like if it would have been at a national level, it would have made life kind of easier. But whatever. They are an epic nation. They do have some Cerner uh, EHR work, but primarily they are an epic nation. And they have there were two credentials. They use, of course, ICD-10 CA. That's their version for uh, Canada. They had so there's uh HIM. I think I wrote it down. So you have your traditional CHIM, and then you have a HICA, which is um, a health information certified associate. And it's this kind of, and this is relatively new. But this trains, it's like the frontline worker. So it's like your front office medical assistant type role, that they are having folks come in. So it's like your entry level, and then you can transition that knowledge and training and information over into the broader CHIM, which I was like, okay, that is how they plan to kind of use professional development in impacting their workforce. So that's their flow of, this is how we're going to keep people coming in, hopefully, um, for them. They seem to really feel like that it's great. It's a great opportunity in their professional path for all, because they understand that people are coming into this field from different areas, but they feel like, and they're limited. They're not doing everything. Like, AHIMA is all over. They're focused on just this area, and so they feel like um, that focus is a good thing. Except they were interested. I can't remember what it was. It was something that we talked about, that they were quite. Oh, it was the advocacy, just the whole advocacy piece as a whole. They were like, this is something that we don't do, and this would be perfect for us. In Canada, so that was something that they were like. They were glad that they came. They got to see it, and yeah, this is something that they may look into. So again, they talked a lot about their rural care struggles. Unfortunately, the infrastructure for the internet and all of that kind of stuff. The same struggles we have in our rural areas exist for them as well. But they were really all about getting the public trust, gaining the public trust, which is again why. Um, Certification is a big thing. It helps with that public trust, and then legitimizes the role of the health information professional in Canada, with the certification piece being required. So I was quite like, oh, they should do this all the time. Bring other people from other countries here so we can hear, or I mean, it's one thing for them to go there, but it was great to hear other folks' perspective from other countries. I was excited about that.
Canada is fascinating because it's huge. It's just as wide as the United States.
Mm-hmm.
And there's a YouTube channel. It's called Wendover Productions. It's Wendover. They
Mm-hmm.
do all kinds of like geographical and logistics types videos. And I think the video was saying something about, I think almost half of the Canadian population lives south of Minnesota, because there's like a little dip
Mm-hmm.
between Canada and the United States,
Mm-hmm.
and the majority of people live like in the basically in that whole Toronto metro like area. Like it's pretty wide, but that's where like 49% of the country lives. It's
Wow.
crazy, yeah,
Wow.
because most of it is uninhabited,
Right.
especially the northern parts.
So I was like, okay, they out here in these streets, just vast. Get
Mhm.
in where you fit in out here in these streets. So that's interesting. Interesting. So I like I said, I appreciated them coming, sharing their knowledge, hearing from them regarding the differences, the pain, the struggles, and unfortunately some of the struggles are similar that they have to what we have. But yeah, it was quite interesting. And then I got to meet with my well, we only actually met with one. Well, we kind of caught him on the fly. Because he was outside taking a phone call, and he was like, "Are you coming to see me?" And it's like, "Well, you're not on our list, but yeah, we coming to your office, and so we got to take a picture with him anyway." And he was cool people, and I appreciate him, and I even told them so, because he is instrumental in the small business stuff here in our county. So I
Okay.
said, "Well, sir, sir. I've been to several of your events, and they make sure to say your name at every event, so we know that you are involved in that small business stuff. So appreciate you for rounding that up. All right, all right. Well, we are at the top of the hour.
Yeah.
I thought this was good information, both from the CDI perspective and giving you some tidbits on what was happening at the AHIMA Advocacy Summit this year. And so, also, if you are interested in advocacy, feel free to be a part of the advocacy. There's like a tab on AHIMA that you can get all kinds of advocacy information and learn the advocacy agenda. Actually, we talked about the Match It Act, um, which deals with the patient misidentification, which is huge. We all know is huge. It costs a lot of money to fix that and straighten that out. It's just a whole mess because unfortunately the government they're fighting against having like a unique patient identifier, which would pretty much make this kind of go away. But in the lieu of that, AHIMA and other stakeholders have been trying to figure out what is a good workaround for that, because it's only getting worse. There are several horror stories that were actually shared as a result of the misidentification of patients and some of the treatment that they were receiving that they shouldn't have because it wasn't for them, or lack of access to health insurance, et cetera, for information that was documented in their record that, again, didn't belong to them, diagnoses they had been given, just a whole mess. And it's unfortunately seems to be happening way more often than not. So we talked about that. And then we also was looking for a legislative proposal on kind of AI in the non-clinical space. I know they're operating a lot within the clinical space and kind of putting standards and parameters around that, but we want to make sure that same things happen in this space, particularly because, and that was like the theme, AI is driven by humans, and humans come with bias. And so we already know that there's a lot of bias in healthcare. We wouldn't want that bias to then be transformed in algorithms that are machine made or machine driven. So
But it already has started with the whole
it's
facial recognition.
with the facial recognition, with it's another thing because there's a is it a Netflix special that it's called Bias or something, and there was a young lady who has been studying this for years and advocating about the actual biases that, to your point, is already there. So they're trying to have them come with standards or regulations um, surrounding this, and they want the Office of Civil Rights to be the um, point people in ensuring that those things are regulated, I guess, or followed. Somebody is keeping an eye on it. So those were the things that we actually talked to our representative about. And so you can go out to AHIMA, you can look at their agenda, the advocacy agenda. It provides all the information um, on what's happening with your organization from that particular standpoint. Now they need to have like a professional uh, advocacy piece as well. I think personally, but that's just me. But we'll see. We will see. We will see. So thank you all again for joining the Saturday morning tea. It was great. It was great. Or even if you're checking out the replay, we're glad that you um, stopped here and listened to the information that we were providing. Hopefully the tea was spilled.
Definitely.
Was the tea spilled today? Was it spilled? I learned something new.
Yes.
Well, I
Hmm.
do every week actually, so it's
Yep.
all good. So if this information was valuable for you, help us share this message with others by sharing the video and subscribing to the channel. Be sure to follow us for more information on all things health information, compliance, revenue cycle, and medical coding. And as you leave, don't forget to hit the thumbs up or like button. And also check out the Coding Nurse channel on YouTube where you can find all of the gems. I would also like to take a moment to wait, let me see. Can I find it real quick? Da, da, da. Yes. I also like to take a moment to thank all of our Patreons for we're still coming up with a name, so keep sending in your keep sending in your suggestions for our names. But we appreciate you. Love the meeting after the meeting. We have some wonderful dialogue, some wonderful information that is shared with some tangible walkaway resources that are at your or fingertips that you can use however you choose to. So if you are interested in that, also we have Q&As. We had a great Q&A last week. We had some Q&As. So if you have coding related questions, health information related questions, feel free to join us as part of the Patreon so you can be part of the meeting after the meeting where we dig deeper. We dig deeper.
Yes.
Yes, yes, yes. Okay, I'll move that now. So, again, thank you all for being here and being part of our Saturday morning tea. This has been a great session. Remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care and have a great weekend.
Bye bye, everybody.